Hey everyone, and welcome to a deep dive that's well personalized just for you. We're tackling PCOS today, a condition that I know from your message can feel pretty darn confusing, especially when you're newly diagnosed.
It really can be.
But the good thing is, like you said, knowledge is power.
Yeah,
And that's exactly our mission today, right? To break it all down.
you got it. We're diving straight into those sources you sent over, covering everything from what those ovarian cysts actually are to like how they're different from PCOS itself.
Yep. And we'll hit on symptoms, which I know you're dealing with some right now. And of course, get to the most important part, what can actually be done about all of this.
Exactly.
You really dug up some great material. There's info on the long-term stuff, health risks and all that, and all sorts of ways people manage this condition. So
Yeah, let's get into it.
let's unpack it. One of the first things that popped up for you was the whole ovarian cyst thing, and I get it. That could be a little
Oh, yeah.
confusing.
Yeah, for sure.
Right.
It's a really common misconception. People hear cysts and they're like, oh, I must have PCOS, but it's not always that simple.
Right, right.
One of your sources, renown.org, really breaks it down well. It basically says, yeah, multiple cysts are a symptom we see with PCOS, but you can actually have multiple cysts and not have PCOS at all.
Huh. Okay, so it's not just about those cysts themselves, but kind of like what's causing them.
Exactly. So imagine this. Your ovaries are like a beautiful little jewelry box.
Right.
Yes.
Take this.
Sometimes you might find a random extra ring tucked away inside. That's like a functional cyst, just a little sac of fluid. Totally harmless, usually goes away on its own.
Okay, I can see that. So those extra rings every now and then, no biggie. But with PCOS, it's like the jewelry box itself is different. Yeah.
Exactly. PCOS is a hormonal disorder, which means basically it's affecting how your ovaries work at their core. It's not just about a few extra rings, it's the whole box functioning differently.
That makes a lot more sense.
Yeah.
And that's especially interesting, I think, because you also found stuff about like endometriosis that can cause cysts too, right? So it's like your jewelry box might have a secret compartment you never even knew about.
Exactly. And that just shows why getting a proper diagnosis is so important.
Absolutely. So let's talk about what this actually feels like. You got a lot of info on symptoms, and they can be pretty diverse, huh?
Oh, they totally are. Imagine your body sending you all these mixed signals,
Oh, no.
like irregular periods. That's
Yeah.
a big one. So fewer periods than usual, or maybe even none at all.
That's got to be frustrating.
Yeah.
Especially if, you're trying to plan a family or something.
Oh, absolutely. And then there's hirsutism, which sounds like a made-up word, but it's just the fancy term for excessive hair growth,
Okay.
often on the face, chest, back places. Women typically don't have much hair.
Right. So it's not just any hair growth. It's specifically where it's not usually a thing for women.
Mm-hmm.
It's got to be tough to deal with, especially like with all the societal beauty standards and all that.
Yeah, it can really affect self-esteem. And to make things even more confusing, some women with PCOS actually get hair loss on their scalp.
Whoa, talk about mixed signals.
Right.
And of course, there's the acne, which I know from your notes was a big concern for you.
Yeah, acne is super common with PCOS, and it can be, more severe and persistent than just your typical teenage acne. So it's really this whole constellation of symptoms, and it can vary a lot from person to person.
So how on earth do doctors even diagnose PCOS?
Mm.
Especially with it being so, all over the place for different people.
Well, it's a process for sure. It starts with your doctor getting a good history, listening to your symptoms. Then they'll likely do some blood work, check those hormone levels, and they'll often do an ultrasound to actually look for those multiple cysts on the ovaries.
So it's kind of like piecing together a puzzle, right?
Yeah.
Using the symptoms, hormone levels, and then that ultrasound picture to get the full story.
Exactly. It's not always straightforward, which is why it's so important to, be open with your doctor, ask questions, advocate for yourself through the whole thing.
Such good advice.
Mm.
And while getting a diagnosis can be like a relief, it also comes with the realization that, okay, PCOS can have these long-term impacts on my health. That came up a lot in your research, huh?
It did. And one of the biggest things to understand is the link between PCOS and insulin resistance.
Okay, remind me again, what is insulin resistance?
Sure. So insulin, it's a hormone that helps your body use sugar for energy, right? With insulin resistance, your cells don't respond to insulin as well as they should. So the sugar builds up in your blood.
Ah, so it's like your body's not processing sugar the way it should.
Exactly. And that's where those long-term risks come in. High blood sugar over time can damage your blood vessels, increases your risk of developing type 2 diabetes and a whole bunch of other serious conditions.
Like what kind of conditions are we talking?
Well, things like heart disease, high blood pressure, even stroke. And it doesn't stop there. PCOS is also linked to sleep apnea, fatty liver disease, and even some types of cancer.
Wow, that's not a lot. It sounds like PCOS is so much more than just like those irregular periods or unwanted hair growth.
It really is. But here's the good news. Managing it proactively can significantly reduce those risks. And that's what we'll dive into next.
Okay, good. I need some good news. So, how do we manage this complex thing? You found stuff on everything from lifestyle changes to medical interventions. Where do we even begin?
Let's start with lifestyle. You have more power than you think when it comes to managing PCOS. Even small changes can make a big difference.
I like the sound of that. So, what are these empowering changes?
Think of it this way. With PCOS, your body just needs a little extra TLC to function at its best. And one of the best ways to give it that TLC is through, a healthy diet and regular exercise.
Okay, so it's not about like fitting into a certain size or anything. It's about actually giving your body what it needs to thrive.
Precisely. Choosing foods that stabilize your blood sugar, reduce inflammation, support hormonal balance. And exercise, even something as simple as brisk walking, can work wonders for insulin sensitivity and just make you feel good overall.
It sounds like these lifestyle changes can impact you, like physically and emotionally.
Absolutely. And remember, it's not about punishing yourself or depriving yourself. It's about finding healthy habits that you can actually stick with. Make them part of your life.
I like that. So lifestyle is a biggie, but what about medical stuff? You found a bunch of options for when those lifestyle changes need a little extra help, right?
Oh, yeah, definitely. One common medication is metformin. It's usually used to treat type 2 diabetes.
So it helps with regulating blood sugar.
Exactly. It basically improves insulin sensitivity so your body uses sugar more efficiently. It can be super helpful for women with PCOS because it can regulate periods and even help with ovulation if you're trying to get pregnant.
It's like a multitasker.
Totally.
What else is out there?
Hormonal contraceptives are another big one. So like birth control pills or the hormonal IUD, they can help regulate those periods, reduce acne, manage excess hair growth, all those things.
So they tackle some of the most like visible and annoying symptoms.
Yeah, exactly. It can make a huge difference for women who are really struggling with those. But of course, the exact medication and dosage, that's all got to be figured out with your doctor. It's about finding what works best for you.
Right, that makes sense. So we've got lifestyle, we've got medication. What about those little extra tweaks? Beyond just diet and exercise, any other things that can
Oh,
help?
yeah, tons. Remember, the holistic approach is key. So while medical treatments are important, those lifestyle tweaks can be really powerful. Let's talk more about diet. Have you heard of the low glycemic index diet or the low GI diet?
Eagerly.
It's basically all about choosing foods that release sugar into your bloodstream slowly. So the glycemic index, it ranks foods based on how quickly they raise your blood sugar. A low GI diet prevents those crazy spikes and crashes that can really mess with your hormones, your mood, everything.
So it's like choosing foods that give you steady energy instead of that quick burst and then you crash.
Exactly. It's about giving your body a nice, reliable source of fuel. Like swapping white bread for whole grain toast, ditching sugary drinks for water or unsweetened tea, trading processed snacks for, like, a handful of nuts or a piece of fruit.
Okay, those are good examples. What about exercise? We talk about it a bit, but where does it fit in the big picture of managing PCOS?
Exercise is huge. One of your sources actually said exercise not only aids in weight management, but also improves mood and energy levels, which are vital for managing PCOS.
Okay, so another multitasker.
Totally. It improves the insulin sensitivity, boosts your mood, reduces stress, helps you sleep better. All wins when you've got PCOS.
So what kind of exercise is best?
Honestly, the best exercise is whatever you'll actually do and enjoy, but generally, a good mix of cardio and strength training is a good place to start. So, think brisk walking, jogging, swimming, dancing, anything that gets your heart rate up. For strength training, you can lift weights, use resistance bands, or just do body weight exercises at home.
Cool. So find what you like and make it a habit.
Yep.
Now, what about alternative therapies? Things like acupuncture or herbal supplements. Did you find anything about those?
Yeah, I did. Those are definitely worth exploring, but they should complement, not replace, conventional medical treatment. Always talk to your doctor before trying anything new, especially if you're already taking meds.
So it's about having that conversation with your doc, seeing what might be a good fit for you.
Right.
Did your research mention any specific alternative therapies for PCOS?
It did. Acupuncture has actually shown some promise in regulating menstrual cycles and improving ovulation. As for herbal supplements, spearmint tea and cinnamon come up a lot. They're thought to have anti-androgenic effects, so they might help reduce those excess male hormones we talked about.
Huh, interesting. So it really is all about taking that holistic approach, exploring all the options, and working with your doctor to find what's best for you.
That's it. And that's exactly what we'll keep exploring as we go deeper into this.
Stay tuned for part 2, where we'll unpack the emotional and psychological side of living with PCOS and dive into some strategies for navigating those challenges.
Welcome back to our PCOS deep dive. Last time we covered a lot of ground, from those ovarian cysts to the link with insulin resistance. But like we touched on, it's not just the physical stuff. PCOS can really mess with your mental and emotional well-being too.
Yeah, it's one thing to read about symptoms and diagnoses, but it's another to actually live with them every day. And from the
Yeah.
sources you sent, this is something you really want to understand better, right?
For sure. Imagine dealing with the irregular periods, unwanted hair growth, the acne, maybe even trouble getting pregnant.
Right.
That can really hit your confidence and self-esteem hard.
It's a double whammy. You're dealing with the physical stuff and then all the emotional fallout on top of it. No wonder anxiety and depression are so common with PCOS.
Exactly. And your sources talk about that a lot, those feelings of isolation, frustration, even guilt.
Yeah, I get it. It's easy to feel alone when you're going through something that could be so isolating.
And it's not just feeling alone, it's also like feeling betrayed by your own body.
Wow. Yeah.
You know, you might feel angry, frustrated, even resentful toward your body.
Makes sense. It's like you're fighting this battle against yourself almost. So let's talk about coping. What are some things you can do to deal with this emotional side of things? Your sources had some good ideas.
They did. One that really stood out was self-compassion. It's so easy to beat yourself up when you're dealing with PCOS. But it's so important to remember, you're not alone in this, and it's not your fault.
Such an important reminder. It's like giving yourself permission to just be human.
Right. And it's not just about acknowledging your struggles, it's about actually doing things to take care of yourself. Your sources mention things like mindfulness, meditation, yoga.
Oh, yeah. I can see how those could help. Mindfulness, being present in the moment, meditation for quieting those racing thoughts that come with anxiety, and yoga. Well, yoga's just good for everyone.
Right. They're all about connecting with yourself, calming the mind, finding some inner peace. And another big one from your sources was finding a support system.
Oh, yeah, for sure. Connecting with others who get it can be huge.
It really can, whether it's a support group, online communities, or just talking to a close friend or family member, having that network makes a big difference.
It's about feeling seen and heard.
Exactly.
Right.
And sometimes that support might come from a therapist or counselor. Seeking professional help if you're really struggling was another big takeaway from your sources.
That's a good point. A therapist can give you tools to deal with the anxiety, the depression, body image issues, all of those things that can come with PCOS.
They can also help you work through any guilt, shame, self-blame, those thoughts that hold you back.
So it's about building that support system, professional or personal, and getting help when you need it.
Exactly. And, your sources also talk about advocating for your health.
Oh, that's huge.
Yeah.
How can someone with PCOS effectively advocate for themselves, especially within, the healthcare system?
Well, finding a doctor who really gets PCOS, or at least specializes in hormonal issues, is key. You want someone who listens, takes your concerns seriously, and is willing to work with you, not just dictate treatment.
So they're more like a partner in your care, not just, telling you what to do.
Exactly. And don't be afraid to ask questions, do your research, and speak up if you feel like you're not being heard. You are your own best advocate.
Such good advice. It's easy to feel intimidated, in a doctor's office. But you have a right to ask questions, to fight for the care you deserve.
Totally. And if you're not feeling that from your doctor, don't be afraid to get a second opinion. You have every right to find a doctor you trust and feel comfortable with.
So it's about really owning your health journey, finding the right resources and support.
Absolutely. And that's what we'll continue exploring as we move into the final part of this deep dive.
And we're back. In the last 2 parts, we really dug into PCOS, from those tricky ovarian cysts to the emotional ups and downs that can come with it. But now let's look ahead. Your research had some pretty exciting stuff about new PCOS research, and I'm really curious to hear what the future holds.
It's a pretty amazing time for PCOS research. Scientists are making huge strides in understanding what actually causes this condition, which is like the key to developing better treatments that actually work.
So about those root causes. In part 1, we talked about the link between PCOS and insulin resistance. What are researchers finding out about that connection?
Well, they're really going deep into the metabolic stuff, trying to figure out exactly how and why insulin signaling gets messed up in women with PCOS. Some of the research you found even mentions specific genes that might make someone more likely to get PCOS in the first place.
So it's like scientists are mapping out PCOS down to the tiniest details.
Exactly. And that understanding is leading to more personalized treatments. So instead of a one-size-fits-all approach, imagine therapies that are specifically designed for your metabolic and genetic profile.
That's incredible, like a custom-made treatment plan based on your own personal PCOS blueprint. What else is happening in PCOS research?
There's a lot. Researchers are also working on new medications that target those hormonal imbalances we talked about. For example, you found some info on drugs that are being developed to lower androgen levels without those nasty side effects that come with some of the older hormonal therapies.
That would be amazing for a lot of women who struggle with those excess male hormones. It's great that they're focusing on fixing the root cause, not just masking the symptoms.
Totally. And that's not all. There's a lot of buzz around the gut microbiome and how it might play a role in PCOS. Remember when we talked about gut health? Well, some studies suggest that imbalances in gut bacteria could actually contribute to inflammation and those hormonal disruptions that are hallmarks of PCOS.
Wow, I never knew gut health could be so connected to PCOS. That's fascinating. So are researchers looking at ways to, restore a healthy gut microbiome as part of managing PCOS?
They are. You found some interesting studies on the benefits of probiotics and prebiotics for women with PCOS. Imagine a future where you could have a personalized probiotic treatment or even specific dietary changes that could rebalance your gut and help with your PCOS symptoms.
It's amazing to think that even something like changing your gut bacteria could make such a big difference.
It really highlights how interconnected everything is in our bodies. And while those medical advances are exciting, your research also emphasized how important lifestyle changes are in managing PCOS.
Yeah, we talked about diet and exercise, but are researchers looking into other lifestyle factors?
Oh, yeah. Some of the research you found looked at sleep quality, stress management, and even things like exposure to environmental toxins, and how they all might affect PCOS. It really seems like that holistic approach is key, addressing the physical, mental, and emotional aspects of well-being.
That makes sense. It's not just about one thing, it's about all these different factors working together.
Exactly. And it's about giving people the power to make choices that support their overall health. Even small things like getting enough sleep or finding healthy ways to manage stress can make a difference.
That's such a great message. It's about taking control and knowing that you can make a difference.
Absolutely. And as research continues, we can expect even more effective and personalized treatments in the future.
There's definitely a lot to be hopeful for.
There is. PCOS is a chronic condition, but it doesn't have to define you. With the right knowledge, support, and self-care, you can manage it and live a healthy, happy life.
And as we've seen throughout this deep dive, there are so many resources out there, from amazing doctors to supportive online communities. Remember, you're not alone.
You got it. And as we wrap up, I want to encourage you to keep learning, keep exploring, and keep advocating for your health.
Great advice. We've covered a lot of ground in this deep dive, and I hope you're walking away feeling empowered and more informed about this complex condition. Thanks for joining us on this journey of discovery.
And we wish you the very best as you navigate your own path with PCOS. Take care.